Hello Internet, my name is Ren. This is Ren Rants, a channel where I rant about many things that I care about with a particular focus on pop culture and politics. And today, infectious diseases. Yes, we're doing this because I live in Seattle, Washington, which is basically at the epicenter of the American coronavirus outbreak. Yay! It's bad, fam. It's not good. So where it stands right now is we have 10 confirmed coronavirus deaths in King and Snohomish County in Washington State. That's up from 3 days ago. Part of this is because until very recently we did not have capacity for accurate testing available. So many of these cases are being identified posthumously, and a lot of people were not diagnosed with coronavirus and have presumably just been spreading it around for the last 6 weeks or so. We have somewhere between 50 and 100 people infected. God knows how many more, because that's just between the confirmed number, between those repatriated from the Diamond Princess and abroad, as well as community outbreaks that were not traced successfully. And it is spreading. So far today, we had an Amazon employee test positive. Medical staff in Renton at a medical facility have tested positive, which also brings me to a relevant point that medical staff are being asked to treat patients without adequate protection because the masks that they need are not available because everyone panic bought them. If you're not a healthcare worker, you don't need those masks. Also, they only actually protect you for about 8 hours with proper usage, and you probably don't know how to use them, so they're not actually protecting you. Good job. Yes, this is an angry rant. I'm really angry because, see, I have a chronic illness, which is an autoimmune condition, and I know a lot of people who also have autoimmune conditions. Also, I just care about other human beings, and I'm pretty concerned about this very deadly virus that can severely impact the most vulnerable patient populations. People who are already sick. Elderly people. The one good thing is it doesn't seem to be impacting children too poorly. So far, no infant deaths and very low infection rate among children. When children do get it, it seems to be very mild. Fortunately, that does mean it seems like it's pretty likely that children will also spread it quite a lot when they're infected if it's mild. But I'd rather it be mild in children, so that's great. What's not great is that between when my university, so I go to law school and it's a little bit separate from the main university. So my university initially sent out an email Friday that we didn't get, that was forwarded to us on Monday morning, in which they basically said they were just going to kind of wait and see what happened. And then in between when that email was forwarded to us Monday morning, and a couple hours later, it turned out that one of our nursing students was potentially exposed because she had treated a patient that was later confirmed to be infected. And so they had to disinfect one of the buildings on campus. What I will say is I'm very pleased and impressed with my school's swift response. I'm not thrilled that they didn't meet or plan before this, but when things got bad, at least they have arranged for more students to have off-campus options to keep up with classes and remote learning. So for students like me who really don't want to get this virus, I very much appreciate that. My office is also potentially allowing employees with these kinds of conditions and with immediate family members with these kinds of conditions to work from home. I think all offices and all schools should have these kinds of policies. Really, I think that whenever possible, everyone should be working and doing things remotely for the time being until this is taken care of in some fashion, because this is bad. And speaking of things that are bad, Emerald City Comicon. Now, I love Emerald City Comicon. I'm a longtime attendee of Emerald City Comicon. This would have probably been my 10th year going to Emerald City Comicon. I'm not going this year. I don't think anyone else should be going this year. In fact, I think they should be canceling this event. This is an event that commonly draws as many as 100,000 people from all over the world to this city. This city that is in the throes of a deadly viral outbreak that is incredibly contagious. You want to put 100,000 people in incredibly close quarters where they're touching shared surfaces, fondling merch, standing in line together, sitting next to each other in crowded convention halls. Are you kidding me? This is nuts. This is a terrible idea. And, you know, it's fair. I didn't expect ReedPop to cancel it. I'm actually genuinely shocked that they're offering refunds because they have a pretty strict no refunds policy. And I sent them an email a couple of days ago and I got no response, but I think through a lot of public pressure via social media, they finally caved and they agreed to give refunds to any attendees who don't want to go. Reasonable. But they should be canceling the convention. I understand why they're not. At this point, I think our state government should step in and ban any gatherings of this size. Because it's 100,000 people. Like, Italy has banned gatherings of over 5,000 people. Other countries are banning gatherings that are even smaller. And they're really letting this event go on. I'm shocked. I actually called my governor's office and left a message because I was just like, what are you doing? Are you serious? And the thing is, it's not even just about Washington because, again, these are people from all over the country, all over the world that come to Emerald City Comicon. This is a big convention. It draws a lot of celebrities and exhibitors and artists from everywhere. And so people come from everywhere to see them. And normally it's a wonderful and amazing event, and I love it. And I would encourage everyone to check it out. But right now, no. Oh, back when the swine flu epidemic was happening, they did not suspend PAX or step up any cleaning procedures. And while they're talking about stepping up cleaning procedures now, I just don't think it's going to be enough. And with PAX, there was at least 100 confirmed cases of swine flu that were spread around just from PAX. That particular outbreak was called H1N1rd, which I find hilarious. But this is just irresponsible. This is gambling with people's lives. People are going to die. And for what? A comic book convention? Are you kidding me? Save it for next year. I'm just mind blown. I'm genuinely just shocked. Like, at first, when there was just 1 or 2 cases in Washington, I could see it. I could see not canceling the convention. I could even see not issuing refunds if people didn't want to go. I would think it's shitty, but I could see it. But at this point, when it is escalating so fast, when the death toll is, like, rising by the day, and when cases are just spreading all over the place, like, I'm refreshing my Google search of, like, coronavirus Seattle or COVID-19 Seattle every couple of hours, and there are updates every couple of hours with a new case discovered here or an employee testing positive there because we just expanded the testing requirements in Washington to finally include more people because previously it was so limited that we just weren't testing anyone. In fact, it was so limited that my boyfriend, who traveled to South Korea in February, was told he didn't qualify to be tested. He doesn't seem to have it, but what are you doing, Washington? So to other states, I would say, don't be like Washington. We have screwed this up. We have shit the bed on this one. It is not going well here. I don't know how we could have done a worse job. It seems like they're trying to start taking drastic measures now, but I think it's too late. And now I'm reading all of these, like, catastrophic articles, and I'm scared to go to the gym. I'm so relieved that I can remote into class and work. And I live in fear. And to be fair, I pretty much always live in fear because people are disgusting and don't wash their hands. And this brings me to what you can do, which is, dear Lord, please, please wash your nasty little hands. Wash them for at least 20 seconds. Wash them with warm or hot water if you can stand it. Wash them multiple times a day. Wash them after eating. Wash them before eating. Wash them after using the bathroom. Wash them after using public transportation. Wash them after touching your doorknob. Clean your doorknobs. Disinfect your doorknobs. Disinfect your desk. Disinfect your keyboard. Disinfect your cell phone. Wipe down these surfaces with Lysol wipes if you can get them. But please don't panic buy 30 containers of Lysol wipes. Please don't panic buy 10 bottles of hand sanitizer. 1 or 2 bottles will last you several months. This is not the apocalypse. You do not need a lifetime supply of hand sanitizer. Stop it. You are making it so that healthcare professionals and people who actually need the hand sanitizer because they are in public-facing jobs or because they are directly dealing with sick people don't have access to it. And this is the same thing that's happening to healthcare workers. They don't have the masks that actually protect them because people went out and panic bought them, people who don't actually need them. So stop doing that. Also, stop panic buying crazy person amounts of food. You maybe need 2 weeks to a month of food in case you end up quarantined at home. You don't need a lifetime supply of food. Calm down. It's actually amazing. Seattle gets really weird whenever there's any kind of panic buying. We always buy up all the tomatoes. My roommate went to Whole Foods and she said there was nary a tomato to be found. In Seattle, we're just like, oh, it's an emergency. I need my vine-ripened heirlooms immediately. Like, there's nothing more perishable than a tomato. What are you doing? And finally, don't touch your face. Don't ever touch your face. Really, it's better for your skin for you not to touch your face, except for with freshly washed, clean hands. And it prevents the spread of illnesses always. So just, it's good practice to not touch your face. Also, try to use your elbow or your knuckles or, the back of your hand or things like that for buttons, door handles, anything like that that's a commonly touched surface. If you can avoid touching it with your hand that you may use to touch other people or other surfaces, you're potentially avoiding spreading those germs everywhere. And last but not least, please stop sharing those memes and articles and images and everything that is supposed to be comforting by talking about how this is only high risk or particularly deadly to sick people and chronically ill people and the elderly. It's incredibly offensive, and not because they're someone's friend or someone's grandparent or someone's whatever, but because they are someone. They are a human being who deserves to not die because you couldn't be bothered to wash your hands. This is ridiculous. This is not comforting. And we can see you. You have no idea how many friends you have on social media that may be in the very populations, and have the very conditions that you're saying, well, it's okay because they're the only ones who are going to die. You're telling those people that you are not safe to be around, and it's not a good look. So please keep all of those things in mind. Try not to panic, but be aware that this is serious and this can escalate very quickly. Be sure to hold the government accountable because this is bad. This has exposed some serious cracks in the foundation of this country. I knew the healthcare system in this country was broken, but I naively assumed that there was some kind of emergency capacity that would be able to be galvanized to do something in event of a situation like this. And instead we have inadequate testing, just a total backlog. We have active contradictions and misinformation from the president and his administration. We have him contradicting public health officials and the CDC and the WHO. And it's just remarkable and so scary because sure, this virus is serious. It is concerning, but it's not the most dangerous thing out there. And I'm really worried about what happens next time What happens when it's a virus with a much higher lethality rate? What happens when it actually is airborne? What happens when it's even more communicable? Because clearly we can't even handle this. And I'm frightened. I'm really scared. This is not how I want to go out. I'm okay with being nuked. Earthquake, sure. Tsunami, yeah, right on, come at me. Wildfire, yeah, alright, not my favorite, but go ahead. Supervolcano, come at me. That's cool, but I'd really, really like to avoid dying in a pandemic. Really, that is the bottom of my list. Really is. So, let's do what we can to prevent the spread to the extent that we as individuals are able. Let's hold our governments accountable and be critical of officials that have absolutely dropped the ball on this one, and be sure to reflect that at the polls this November. And we'll see you next time. Assuming we're alive. Be sane.